In 1917, Dr. Adolf Gundersen had a simple idea. It was a simple idea whose time had come. He believed the doctors at his hospital should know how to diagnose and treat patients. In La Crosse and throughout the country at that time, there were doctors with little more than paper mill degrees. As a result, these doctors often failed to diagnose or properly treat patients, and in some cases, men, women, and children died. In 2003, the National Child Protection Training Center had a simple idea. We still believe, that teachers, daycare providers, nurses, doctors, psychologists, social workers, police officers, prosecutors, and judges of this country who interact every day with abused and neglected children should know what to do. It was a simple idea whose time had come. In searching the online catalogs of 1,416 universities offering degrees in the fields of education, nursing, social work, criminal justice, and psychology, Winona State nursing professor Jackie Hotlevig discovered that only 29% had any mention of maltreatment, and not one of these universities had so much as a concentration in child maltreatment. As it turns out, we're living in a country in which on-the-job training is the primary source of educating child protection professionals. As a result, many mandated reporters fail to recognize even clear instances of abuse, and when reports are made, often child protection professionals fail to respond with excellence. According to the United States Department of Health and Human Services, 70% of the most egregious cases of child abuse every single year are not investigated at all. In partnership with Winona State University, we implemented an intensive interdisciplinary child protection minor unlike any in the world. The Child Advocacy Studies minor that began here at Winona State is now replicated in 29 colleges, universities, law schools, medical schools, and seminaries in 15 different states, with dozens of more programs just around the corner. In the past 10 years, the National Child Protection Training Center has provided intensive training to over 70,000 child protection professionals in the field from all 50 states and 17 different countries. Within 48 hours, I'll be on a plane to Belarus, and from there I go to Germany, and next month, Japan. It turns out the problems confronted at our center are faced the world over. As long as there is a need, the National Child Protection Training Center will stand with those who stand with children. But from this day forward, we will do so as part of the Gundersen Health system. The National Child Protection Training Center and Gundersen Health are cut from the same cloth, a fabric woven in the timeless truth that when heart combines with knowledge, the world changes quickly and forever. The partnership between Gundersen and the center is born of a simple idea. Since 1998, the Centers for Disease Control and Kaiser Permanente in San Diego have conducted a series of pioneering studies called Adverse Childhood Experiences, or ACEs. In reviewing the medical histories of over 17,000 adult patients, the ACE researchers discovered something startling. They discovered that adverse childhood experiences, including sexual abuse, physical abuse, emotional abuse, and witnessing violence, had a strong statistical correlation to virtually every medical and mental health condition known to man. These conditions included obesity, cancer, liver disease, heart disease, smoking, alcoholism, and depression. On average, a child with 6 or more adverse childhood experiences will die 20 years younger than a child who has never known the fearsome side of life. The ACE researchers concluded the earliest years of infancy and childhood are not lost, but like a child's footprints in wet cement, are often lifelong. In discussing this research with our friends at Gundersen Health, we reached our own startling conclusion. What if there was a medical institution willing to incorporate ACE research into every aspect of medical, mental health, and spiritual care, and then transmit those findings, that success, to every interested medical facility in the world? In a relatively short span of time, we would be detecting childhood traumas decades earlier, and we would be saving billions of dollars and millions of children. It is a time whose idea has come. It is a simple idea that every suffering child understands. Not long ago, I was training police officers in New York. I got up early the next morning to catch a flight home, and in the hallway, a cleaning woman stopped me and said, "I was that girl." When I told her I didn't understand, she explained that the day before when I was speaking, she overheard me and she snuck into the back of the room and listened. She told me that she was sexually abused by her father. She said there were lots of signs, and she told lots of people, but nobody, not her mother, her brothers, her sisters, the police, the teachers that she told, nobody believed her or helped her. She told me she became a juvenile delinquent, became addicted to drugs and alcohol, and that she tried to kill herself more than once. Not one of her many medical and mental health providers ever asked her, "Have you been hurt?" If they asked me, she said, I would have told them. She said she was doing better now. After all, she had this job. She wanted me to know, though, that all the things that we were teaching, how to recognize and respond to abuse, any one of those things could have spared her years of pain. She told me she would pray for the National Child Protection Training Center. She told me she would pray for the National Child Protection Training Center every day for the rest of her life. She then grabbed my hand and said, "Remember me." I remember her. Every waking moment of every single day, I remember her. I'm asking that you remember her too. This woman and a million more just like her are the shadow children of our country. Boys and girls, young and younger, who from the corners of their room ask us simply, is it safe to come out now? This day, December 5th, 2012, Gundersen Health System and the National Child Protection Training Center join hands in support of a simple idea. A simple idea that we should tell hurting children, we should tell the children in the hiding places, yes, it is safe to come out now. It is a simple idea whose time has come.